Okay, I'd like to bring this meeting to order, and at this point, I would like to have everybody read the meeting minutes, and we'll take a vote on that in just a second. Okay, all in favor of the notes as written, say aye.
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 All right. Notes have been confirmed, and then let's go ahead and our next item of consideration is the Dr. Morris. If you've got some things that you can share regarding the status, the latest and greatest information about the current affairs.
Nothing really new other than what Christina presented at the last city council. It's been kind of interesting. I went to Mid-America Regional Council, Jackson County's website today to download the most recent data, and their gateway is closed. They're supposedly improving it. So I didn't really have that data, but basically it shows the same thing that Missouri is showing, that over the last 3 weeks or so, there's kind of been a general downward trend, which is good. Nationally, it's pretty much the same thing. The new cases are up to date 121,000 plus, but overall it's trending down. Deaths nationally today that were reported were 3,192, which was also up, but generally it's trending downward. So all of that is kind of good news. Both Missouri and Kansas have got about 7% of their population vaccinated. Missouri, because we really enjoy rankings, are 47th in the country as far as how many doses we've distributed. It's interesting, as of today, Missouri has received 904,000 doses, and they've administered 482,000 doses. So whoever has the other doses in the refrigerator should pony them up and let them be given. So we've given about 53% of the doses that the state has received. But that's about all I've got to say.
So what is the shelf life with the refrigerated vaccines?
Frozen, they're good for 6 months, I think.
Okay.
Once you thaw them, it depends on which vaccine you're talking about. They need to be given within 4 or 5 hours for the most part, which is why, I don't know if you guys saw on television, there was a team in the Northwest that was headed somewhere for a vaccine event and got stuck because there was a truck jackknifed in the road, and they just went up and down the line of cars vaccinating people because the doses had already been thawed and had to be administered, and they didn't want to throw them away, which is really a wonderful thing to do. So
that's quick thinking.
Yep.
Terry, might you talk a bit about the variants, the England and South African things? Are those things that have we spotted them in our backyard yet? And is the progression of movement something that we should be paying attention to? And does that affect how we ought to? You're providing a positive report that makes a layperson like me think we're headed in the right direction. Is there a bump in the road coming? I guess is sort of my question.
My 8-ball is in the other room, so I can't turn it upside down for you. That's the whole problem with coronaviruses. We've never had a vaccine against the flu because it's a coronavirus and it's different every year and it mutates all the time. And COVID-19 is a coronavirus, and so we don't know. The British vaccine seems to respond. The South African vaccine is probably going to respond, but we're not far enough down the road with that to really know. It's going to take a while. And Missouri, just because of lots of reasons, has not been huge on looking for variants. So we probably have them. We just aren't spending the time and money to look for them.
So in other words, don't put your masks too far away and don't forget where you put them.
Yeah.
Christina, any other topics of interest from the city's perspective for tonight's meeting?
I mean, the biggest question, everybody has is the vaccine, and when is the city going to get it, and when are we going to start putting it out? And the honest answer is, man, we wish we knew too. We make the request to the state. I copy Dr. Morris on it when I do, and we're hopeful that they'll grant us some, but they have some new allocations methods that the state is going to abide by for now. That put, and I'm not going to say right or wrong, hospitals, essentially they're getting the majority of the vaccines as high throughput healthcare centers. So what we've done is, I've reached out to Centerpoint and Dr. Nelson to offer to partner and to help however we can. Because if they're the ones who have the vaccine, along with, Truman Medical Center and some of the others, well, then we'll support them. Because what we want is we want those shots in arms too. So whatever they need, whenever they need it, we'll do it.
Okay.
Do we have a plan for once we know we're going to get vaccines? I know we have a space because the city council agreed to open someplace at the mall, which has plenty of space and good parking. But do we have a plan for how appointments will be made? I was sharing with Ralph my story about 2 weeks ago. Some of my acquaintances had gotten vaccinated at Truman Medical Center, and so I thought, that's, I'll get in line at Truman Medical Center. And I dialed my phone. You hit redial and then number one and redial number one. And I dialed it 190 times in a row over the course of a couple hours, and then got put on hold for 45 minutes and got my appointment for March 10th. An hour later, my wife said, "Did you get the email from KU?" And I said, "Oh, let me look and see." And 48 hours later, I had my first vaccine dose. So, the frustration, particularly that us old folks are dealing with, is most people won't sit there and hit redial 190 times. But I have nothing going on in my life whatsoever of import, so I can do that. And so I just didn't know if we had an idea of, once we get a flow of vaccine, how we're planning on getting people into the pipeline.
Well, we actually discussed this with the Mid-America Regional Council this afternoon some. Also, it's continuing to be a subject because there's 12 million lists that are floating around. It seems like every health department, every hospital has their own list. And a lot of people have put themselves on every list they can dial the number or, enter onto the website. So we all want to share those lists. Independence has not done a list because not having the vaccine yet, we saw no reason to get people's hopes up and confuse everyone. I know Jackson County has said that they have 170,000 people on their list, and they've indicated that they are more than willing to share the Independence people with us. Our plan is we have literally over 500 volunteers with our Medical Reserve Corps right now, and they are all itching to do something and help. We had set up a phone bank at the beginning of all of this. We were going to reactivate our phone bank and put some of those people to work. That's our plan. We're missing a pretty vital component, the vaccine. So
it's just really challenging. I mean, it only took me one phone call to get off Truman's list. Once I had my appointment, there was a different number you called, and they said, "Oh, thanks for letting us know," and they canceled me. But I'm sure I'm still on Jackson County's list because I signed up for that months ago, and there's kind of no way to get off. So when you start dialing people to come in and get their vaccine, and you're ready to thaw today's 100 doses or 200 doses, you've got to give those doses or they're wasted. And so just as we get closer, that's going to be a big hurdle to jump over of how do we get people in.
We do have, I mean, we have the same booking system that we used for, and that we're still using for our COVID testing. And it was our intent that we utilize that same system. We may not put it, at the beginning available for the public to access. But for us internally to be able to get people scheduled, and it also has, the ability to then reschedule them when they come in for their first dose to go ahead and reschedule them on site. So, and then Jason's asking, will there be anything at Arrowhead, and when will Centerpoint do vaccinations? I don't know about Arrowhead. I know I keep hearing Jackson County talking about doing it, but I've yet to see plans. Centerpoint doing vaccinations, they today made public, or at least shared with some of us, and we made it public, their vaccination website link. So you can now sign up through Centerpoint to start scheduling, or at least to indicate that you're interested in getting your vaccine through Centerpoint. I can't speak for them. I know that HCA is on the rotation to receive their vaccine next week, because it was Truman, Liberty, and North Kansas City this week, and HCA hospitals are receiving next week. So.
And then what vaccine, which one are we getting here in the metro?
So they've pretty much told us if you're a hospital, expect Pfizer. If you're not a hospital, Moderna is what you can expect. But Moderna is in very short supply right now. So that's why a lot of us are waiting.
And then each of these are 1 or 2 shots.
They're all 2-dose right now. All the vaccines that are approved here in the United States are all 2-dose.
Okay.
It's going to be, depending on who you talk to, probably April before the 1-dose becomes available, if it is authorized and becomes available.
Okay.
And it's important to understand also that it's not really part of it, of course, is the government's fault, because everything's the government's fault. But I've got an article from Reuters from a couple weeks ago that Pfizer has only delivered half of the doses they promised to the EU. And Moderna is the same way. So I think it's a matter of production did not meet nearly what was promised initially. So countries in the whole world got their expectations up higher than they should have.
And then I have one question regarding the delivery of the vaccine. How long do you think it'll take you to get started, get ramped up and going full blast? Half a day, 2 days, as far as getting your volunteers and everybody organized and
well, our volunteers are already volunteering across the metro. So they're not only volunteering, but they've been given the task of observing, so that we figure out what others are doing wrong and we don't do it when we start. Now, our initial plan is that the first week we do it, we're just asking for the minimum amount so that we can get our feet wet. And then that next week, after we have our test run week, we'll ramp it up as fast as we can. I mean, honestly, the biggest thing that's slowing us down, besides lack of vaccine, is, storage capability. We have room to store some, but we don't have room to store 10,000 doses. We just don't. So, I mean, we may be able to do a couple thousand doses in a week, but that would be stretching us to our limits on our current capacity. The state has talked about additional funding to help local public health departments with their equipment and infrastructure that they need in order to do it. I mean, we have the volunteers. We've done, for years, we've done runs where we've, done flu clinics or done, fake pods where we know what to do. We just don't have anything real to put in anybody's arms at this moment.
So you've anticipated a maximum flow of delivery of vaccine, and what would be your estimated time frame for getting probably 90% of the vaccine out there?
So the state, as I think Dr. Morris mentioned, there's a lot of vaccine that's sitting in fridges right now, and the state has indicated that they will penalize any providers that are leaving vaccine for longer than a week in a fridge. So whatever you order, you use that week, and then you order for the next week. You don't leave it sitting. So because it's so scarce right now, if you can't get it in somebody's arm within a week, you shouldn't be having it. You're not supposed to be storing it.
Okay. Any other thoughts or questions that you would like to place on the table here today?
No, though I saw Dr. Nelson joined us, so I don't know if he has an update and if he's available to speak.
Hey, good evening. I'm just trying to decide if I want to admit I'm on here and if I want to talk about this topic. So,
Sorry.
We can pretend we didn't see you.
I pointed my gray hair at raising 2 daughters, at being in healthcare, and then now I'm going to worry about if it's going to make it through all this and there'll be any left to be gray. But yeah, so it's been a really interesting few weeks. We were really struggling to be just candid with all of you about where to position ourselves after we got through the kind of phase 1, tier 1, 1A, and did our best to try to get the bedside caregivers and the clinical folks and the first responders done, because we've, just as has been alluded to, been worried about kind of raising our hand and, to take on a situation that, as you pointed out, Christina, you can be all ready and able to do, but you have no control over, the product you need until it arrives. And then, as you pointed out, the state's been, with all due respect, pretty difficult on some of the providers around the state, particularly some of our rural colleagues, who have not gotten their shipments when expected. And then when they arrived, there were all sorts of challenges meeting the timelines and all. And so there were just there was a lot of consternation. So ultimately last week, the Hospital Association and the state were on a phone call, and the state announced that Governor Parsons was going to resurrect or reconstruct the delivery approach, and they were going to, before the week was out, identify 16 health systems and 9 regional delivery sites. The 16 health systems had to commit to become high capacity vaccinators, as they defined it, which meant accepting a shipment of 5,000 vaccines and then meeting typically the 7-day delivery requirement. The 9 regional areas were going to be associated with the 9 Missouri State Highway Patrol regions, and were going to be managed. Initially, the thought was by the National Guard contingent, and then there were a couple of other buckets of delivery systems related to health departments and federally qualified health clinics and systems. So long story short, we were pretty convinced, despite our size and girth, that would be a significant obligation to raise our hand for. So ultimately, the HCA division president and the president of St. Luke's Health System conferred and made a decision that we would collaboratively commit to one of the system spots. So it was just recently announced that offer was accepted, along with, I think, Truman and then North Kansas City Liberty in the Kansas City areas. I think 3 separate entities, at least the way I understand it. And then we just got word about a tentative shipment plan that's supposed to start for us next week. I think 1 or 2 of the others are starting this week. And then we are literally trying to figure out logistics of how we're going to manage and who these folks are, because as I heard alluded to right as I joined, there's just a litany of lists that are circulating out there. And so we had a couple of calls this afternoon and some more tomorrow to try to sort out how we're going to manage that. Most of the systems we've tried to use created either internally in our system or in conjunction with Show Me Vax have not consistently worked through all of this. So there's been an incredible amount of time spent on the back end doing a lot of duplicate recording and reporting to make sure that at least at a minimum we get everybody into Show Me Vax, the statewide system, to document. So contemplating how we're going to do this on, even a greater scale is still a bit daunting for all of us, but we'll do our best to try and do that. What we think we're going to do is probably do some combination of Centerpoint and research on a rotation, then with our smaller hospitals, Lee Summit and Belton, and trying to figure out a way to balance allocation to get across, those four communities to the extent we can. And that's all literally as we speak still being discussed. And then as you also pointed out, somebody got a little ahead in our system and went ahead and I think launched a link and some announcements today. We pulled back some of that mid-afternoon just because we weren't quite ready. And my understanding is the link basically feeds to yet unfortunately another waiting list. So that's why I said struggling a little bit, because it's just a difficult conversation and there are just so many opinions about what's happening and what's not working. But at the end of the day, we're trying to focus on getting needles in arms, and that's what we'll do going forward. But I can't tell the board exactly how that's going to happen yet, because we're still trying to sort out what the expectation is going to be for us as far as how to get at who in this community. What we've seen is basically just a self-attestation that goes along with signing up. So if that's the case, then that'll probably be how we ultimately end up moving forward.
Well, thank you, Dr. Nelson. We appreciate the update.
And then along the way, we're trying to take care of some people in the hospital who are sick. So that's been the real trick for us, is those of you who can imagine that, when we agree to take this on, we're delighted to try to help, but with that expectation that Christina alluded to, it's a little challenging to kind of balance the resources. And we certainly know there's a volunteer community out there. It's just logistically for us trying to sort out how we integrate them into kind of our operational system, and then meet all of the state, requirements for what we need to make sure we do to deliver the vaccine.
Well, thanks for all you're doing in the community as
sure.
As the hospital goes. And what's your percentage of beds open or being used?
Well, that's the delightful news. And if anybody has any questions about what impact this might have, we are just blown away by what we saw happen. Within 10 days to 2 weeks of the first vaccine delivered on December 22nd, our employee positivity rates and absenteeism rates dropped by half. And we were consistently throughout October, November, and December tracking 20 to 25 employees out at any given time. The past 3 days, we've had 0 or 1, at least with COVID-related illness out. And that trend dropped dramatically starting the first week in January. And the other awesome news is, as of this morning, there were only 9 COVID-positive patients at Centerpoint. We peaked in the post-Thanksgiving phase, I think at 50 or 51. And research had been tracking in the 110 to 140 range, and they've been in the 60 to 70 range. And my colleagues across the health systems on the CMO call reported similar drops. So we can't let off the gas here, but we think there's at least some correlation, not necessarily linear or direct, but with some potential impact to the vaccine itself. So,
Well, that is good news. Thank you very much.
Can I ask a question?
Yes, go ahead.
please.
I'm new to the committee and I don't know all the things that have happened before, but Centerpoint is vaccinating the community, right? It's not just employees and patients.
We just started, so that was why I was giving a little bit of background. It was all really driven by a retrenching of the state's program last week and an ask for health systems to step up. Prior to that, our focus had really been on the tier 1, 1A providers and first responders, but it does look like we'll be starting actively in the community now.
Where will you actually be doing it physically?
Yeah, so as of this afternoon, our plan is still to do it in the auditorium at the hospital. There was discussion, as you can imagine, about other locations around the community. And with that comes pros and cons. And we have so much reliance on a lot of our staff who come just on a moment's notice when they can free themselves up when vaccine arrives and we need to get it in arms. That logistically at the facility has been probably, or not probably, at the facility to date has been best as we get more broadly in the community. Not completely sure if it'll remain just there or if we will look at some other venues. So
My next question is if that's true, and you know, what are the possibilities that we could coordinate rather than having two lists? We have one list, and I don't know whether you're set up to do it or we're set up to do it, and have basically two clinic places, one at the hospital and one across the street at the mall. I guess, is that where you're having the vaccination place? Is it the mall? Is that correct?
Yes, there's a space in the old Macy's, or in the current Macy's, the old section of it, that we have reserved.
Okay, so the idea would be is we have one master list for independents. It's run out of one place, and we schedule Clinic A and Clinic B, and maybe we wouldn't have to spend resources running two lists and having two phone numbers and having the same people. Just a thought. I don't know what's possible.
yeah, I think, we're open to any conversation or consideration. It is, and again, and like Terry said earlier, blame the government. I don't mean to be that way at all, but it has been so difficult to really move down a planning pathway when the product that you need is, just not in your confirm, control, bless our Truman friends' hearts. We saw Charlie on the news the other night, and they've been in the vaccine plan and ended up without vaccine and had folks arriving. And so then you just have to kind of be contingent and do what you need to. So I'm willing to obviously figure out and work collaboratively to the extent we can. We've just struggled because it's been hard to know. I mean, we literally this afternoon at 2:00 for the first time saw what the state is proposing shipping to us since we committed the end of last week to do this. So we're literally trying to figure out, how to manage that piece. And again, we talked about potentially looking into other sites off-site. We talked to the event center back, I think, the end of the year when we thought we were going to get a series of shipments, and then those all ended up being canceled and reallocated out to the skilled nursing units across the state. So we kind of just pulled back on that. And we were kind of standing down till this call last week with the state. So, sorry, I don't have more definitive answers. It's been a series of kind of plans and restarts from our perspective.
I mean, I understand that there's the vaccine comes in dribs and drabs, but maintenance of the list as far as who's going to get it next might be something we could coordinate, is what I was wondering.
Sure.
You know,
What is the estimated time arrival? Is there any potential, like a week, 2 weeks for our first shipment?
Well, for the City of Independence, no. We have to make the request by Wednesday night, 5 p.m. I think I put ours in Tuesday. We find out Saturday whether they're going to ship anything to us. And if they ship it to us, generally it arrives on Monday or Tuesday. But we would find that out on Saturday. But it was indicated earlier this week that we shouldn't get our hopes too high this week either. So we're still trying. We're scheduling. We're looking at, volunteers and making sure volunteers are available for next Wednesday, that if we get told we're getting vaccine, that we'll have them scheduled to start on Wednesday and ready to go. But, we're not trying to get too hopeful.
So it's kind of like 1 week at a time?
We're told that we're going to get a shipment by next Tuesday close of business. And that's a shared allocation between us and St. Luke's, again, as one of the high capacity health system vaccinators. So I think we'll have to wait and see. So that'll be our first foray into this new phase. All of the vaccine we've delivered to date has been allocated to us to try to get the clinical folks vaccinated, and then the first responders. And I think we've done about 4,000 so far, and we finished second dose for all of the first tier folks that we vaccinated initially the week of Christmas, and we're starting through some subsequent second doses. It's interesting, Christina, you mentioned they said Pfizer to the health systems, which has been generally what's happened, but we've essentially done all Moderna. We've done 300 Pfizer, and the balance of everything, and everything going forward, we're being told we're going to get is going to be Moderna. So don't know whether that'll, yeah. And again, I don't know whether that'll pan out. That's just what we heard today.
The state may, and we're on different calls with the state, so I'm talking to different people than you are. So obviously it's a different story. It's fine.
Yeah, understand. Yeah, no, I mean, I was just saying, just so you know, that's what we're hearing, but we'll see what arrives in the mail.
Daryl mentioned second dosing. That's another fly in the ointment that you have. You have 100 people come in today to get their shots. They're going to be back in 4 weeks. You need to have their 100 doses plus another 100 doses, assuming you were going to do 100 doses a day. You have to have 200 doses because you've got to give them their second dose at the appropriate time, regardless of what the CDC suggests. But it's a tremendous sticky wicket.
Well, thanks for all your hard work, Christina. We know you're in a pickle half the time every day, so I'm sure you're probably having a lot of fun and enjoying you'll have quite some stories to tell, I'm sure, when it's all over.
Well, today we had a lot of fun because we're still trying to do COVID testing, so we had fun getting the sleet pelting us while we were standing out there, so it's good times.
Well, are there any other comments or thoughts that anybody has before we bring this meeting to an end?
I had a question for John, maybe. I noticed today on the state site that Independence over the last 2 weeks had 41 plus cases of COVID in the preschool to high school age, and Blue Springs had 30 plus. And the educators are in phase 2, tier 3, or
tier 3.
Yeah.
1C.
And I know on the other side of the state, I have a connection, and they're having horrible problems with staffing. We want to get all of our kids back in school, but teachers are afraid to go to work because they have diabetes or hypertension or whatever they have. Is that something we're seeing a change in Missouri with, or are we still staffing okay?
Staffing has not been as big as an issue as it was earlier, but it is a concern, and it is the primary reason school districts throughout the state close, whether it's a building or a district-wide. It is the primary reason. And there have been some streamlined processes for getting subs because you need a larger sub pool to account for just the folks who would sub to even cover those classrooms. So there's been widespread encouragement to get kids back in school. There's enough of the population that's said they will stay virtual so that schools can then meet that social distancing requirement and then use all the mitigation practices while they're in school. Because we've shared with folks over and over again, schools are not high transmission places. It's the community spread, so we can do schools as long as we have enough adults to do it.
Thank you.
Mm-hmm.
Okay. Anyone else? Do I hear a motion? Meeting adjourned. See you guys. See you in a month.
Bye-bye.